Hi there, my name is Jordan Kataoka, and I am a UOP second year Master's Athlete Training student. I'm here to help educate you on some at-home prevention and management techniques for plantar fasciitis. My target audience for this specific presentation is specifically geared towards female collegiate basketball athletes, especially those players who are constantly on their feet, running up and down the court, playing multiple game tournaments back to back to back. I myself was a basketball player most of my life, and I definitely can relate to having achy feet and needing that sweet relief. Hopefully, these tips and tricks can help educate you on what to do next time when you feel and experience plantar fasciitis pain. So what exactly is plantar fasciitis anyway? Glad you asked. Plantar fasciitis is the most common cause of heel pain in adults. About 8% of athletes have plantar fasciitis. To be more specific, plantar fasciitis, or the plantar fascia, is a thick band of tissue that connects the heel bone to the toes at the bottom of the foot, seen in this picture to my right. Now knowing where the plantar fascia is located, the suffix itis means inflammation. This makes more sense knowing some of the signs and symptoms of plantar fasciitis, which are as follows: swollen heel, hence the inflammation; pain at the bottom of the heel and arch of the foot; a tight Achilles tendon; and pain is worse in the morning when you first stand or sit for a long period of time. One of the jobs of the plantar fascia is to help hold up the inside arch of the foot, and any load or weight bearing on said arch stretches the plantar fascia. Some risk factors of plantar fasciitis are having flat feet, or a condition called pes planus, because there's no arch whatsoever, as seen on the picture to the left, and therefore there's no support. Also, having a high arch, or pes cavus, is also a risk factor due to the fact that the foot does not have enough surface area to weight bear. Being obese is a huge risk factor. Running excessively on hard surfaces, such as a basketball court, or maybe when you play in the street or on concrete. Prolonged standing and walking, doing defensive slides, and tightness in the Achilles tendon and deeper foot muscles due to running, passing, dribbling, cutting, jogging, all actions done on the basketball court. Here are some stretches you can do at home on your own when you're experiencing plantar fasciitis pain. The first being a simple stretch of the plantar fascia, shown on the left. Try to do this stretch early in the morning when you first wake up. First, stabilize your heel with one hand, while the other hand is going to pull your toes towards your face. This motion is called dorsiflexion. You will be able to feel a pulling and stretching sensation along the bottom of your foot, and you may even feel it in the back of your calf. This stretch helps elongate the muscles after being in bed for a long period of time. Hold this stretch for about 30 seconds and repeat this about 3 times. And if you have pain in both feet, make sure you switch feet. The second stretch on the right is called on the wall calf stretch. After you get up in the morning, wake up, go over to a wall, and we're going to place our toes on the wall and put it in that dorsiflexion motion. You should be able to really feel an intense stretch down the back of your calf muscle and the plantar fascia once again. If the stretch is too intense, try and back off. If it's not enough, try and lean forward towards the wall and place your foot higher along the wall. make sure that both your knees and your toes are fully extended. Once again, hold this for 30 seconds and repeat 3 times. Don't forget to switch sides. Do you want some instant relief to manage your plantar fasciitis? Well, some manual therapy you can do on your own is to simply roll your foot over a tennis or lacrosse ball. For some extra relief to soothe some pain and discomfort, you can do an ice massage. You can do this by taking a frozen water bottle and roll your foot on top of the water bottle. This is known as cryotherapy. That cooling feeling, along with the added pressure of weight bearing over the frozen water bottle, is a sweet relief, especially after a long practice and being on your feet all day after classes. Try and roll for about 5 to 10 minutes for both techniques. According to studies done by Goff et al. In 2011, the use of night splints, or night dorsiflexion splints, can also help with plantar fasciitis, especially with that worse early morning pain during the first few steps when you wake up. Night splints have produced highly positive outcomes such as resolution of symptoms within 12 weeks of use. The athlete may even see improvement as early as 4 weeks of use. Isn't that exciting? Here are some pictures of specific night splints. On the left is an anterior night splint, and then on the right is a posterior night splint. You can purchase these at your local drugstore such as Walgreens or CVS. And there's always Amazon. They cost around $17 to $35. That's not too bad, right? Multiple studies done by Goff, Bishop, and Grimm et al. All claim that by wearing orthotics will help reduce the loading of plantar fascia while weight bearing. This should also help hold up the medial arch of the foot without putting direct pressure on the plantar fascia. According to these same studies, the best kind of orthotics for an athletic individual such as the collegiate female basketball players are the semi-rigid ones. This is so because they help improve that first step morning pain, help alleviate back pain, and reduce plantar fascia thickness over a 12-week period. Where can you purchase some orthotics, you ask? At your local Walgreens. They even have specific insoles for plantar fasciitis. And the price range is pretty reasonable. It's about $10 to $22. Thank you so much for your time. I hope that you were able to learn a little more about plantar fasciitis and what you can do at home to help prevent and manage it. Don't be afraid to ask your coach and local athletic trainer for any more advice because we care for you. Thank you.